Hypertension is defined as systolic blood pressure more than 140 millimeters of mercury and diastolic blood pressure more than 90 millimeters of mercury over two readings measured at more than two separate clinical visits. It cannot be diagnosed at one reading unless it is severe or there is associated end organ damage symptoms. Now, I'll describe classification of hypertension. It is classified into normal blood pressure, prehypertension, and hypertension. Hypertension is further classified into stage 1 and stage 2. The normal blood pressure is systolic less than 120 and diastolic blood pressure less than 80 millimeters of mercury. In prehypertension, systolic blood pressure is 120 to 139 or diastolic blood pressure is 80 to 89. In stage 1 of hypertension, systolic blood pressure is 140 to 159 and diastolic blood pressure is 90 to 99 millimeters of mercury. And in stage 2 hypertension, systolic blood pressure is 160 or more than 160 millimeters of mercury or diastolic blood pressure is equal to 100 or more than 100 millimeters of mercury. Now, what is hypertensive urgency? It is severe hypertension, typically systolic blood pressure more than 180 millimeters of mercury or diastolic blood pressure more than 120 millimeters of mercury in an asymptomatic patient. There is another term, hypertensive emergency. It is defined as severe hypertension with end organ damage, that is, neurologic changes, myocardial ischemia, infarction, coronary artery disease, or aortic dissection, etc. What is malignant hypertension? It is defined as severe hypertension, systolic blood pressure more than 200 and diastolic blood pressure more than 120 millimeters of mercury. It is associated with vascular damage, that is fibrinoid necrosis in vessels. It is associated with eye symptoms like blurred vision and headache. It is associated with bilateral retinal hemorrhages and papilledema may or may not be present. It can also be associated with acute kidney injury, heart failure or encephalopathy. White coat hypertension in simple word is described as when a person visits clinic or hospital, his blood pressure is raised due to anxiety. It is called white coat hypertension. Now, what are the causes of hypertension? In 95% of cases, it is idiopathic, that is, there is no identifiable cause. Whenever there is identifiable cause, it is called secondary hypertension. It can be due to renal artery stenosis. When there is renal artery stenosis, blood flow to the kidney is reduced and there is increased production of renin, which will increase blood pressure due to its association with renin-angiotensin-aldosterone system. There can be endocrine causes like hyperaldosteronism. Aldosterone increases salt absorption from the kidneys. It can also be due to raised thyroid and parathyroid hormone. There can also be Cushing syndrome, and pheochromocytoma is a surgical case in which there is tumor of adrenal gland which produce increased epinephrine and norepinephrine. Now, medications can also cause hypertension. Birth control pills are the most common cause of secondary hypertension in young women. TCA and NSAIDs, analgesics, can also cause hypertension. Now, in minor causes, there is obstructive sleep apnea. What are the risk factors for hypertension? It is divided into modifiable and non-modifiable risk factors. Among non-modifiable risk factors, there is age. Both systolic and diastolic blood pressure increase with age. Second one is gender. It is more common in men. And third one is race. It is more common in African Americans and black races. Among modifiable risk factors, there is obesity, sedentary lifestyles, hypercholesterolemia, and increased sodium intake and alcohol intake. Also, cigarette smoking is associated with hypertension. What are the complications of hypertension? It affects cardiovascular system with resultant coronary artery disease like angina and myocardial infarction. And it can also lead to congestive cardiac failure because untreated hypertension can lead to left ventricular hypertrophy. In eyes, it can cause hypertensive retinopathy. It also affects kidneys and can lead to acute kidney injury and chronic kidney disease or CKD. In CNS, it can lead to stroke and transient ischemic attacks. This is all I can cover in this video. In my next video, I will cover diagnosis and all guidelines about treatment of hypertension. So be sure you watch my next videos.